Blood glucose monitoring is one of the main tools used to check blood sugar levels and to help monitor and control diabetes. Over the next few minutes, we'll demonstrate how to properly monitor blood glucose levels using the Freestyle Brand Freedom Lite glucose monitoring device. If you are using a different brand, please refer to your specific device's user manual or contact the 800 number on the back of your monitor. The Freestyle Freedom Lite includes blood glucose test strips, lancet, and a lancet device. Blood is applied to the glucose test strips in order to obtain the result. Blood glucose test strips are light, moisture, and temperature sensitive, so keep the bottle tightly sealed and store in a clean, dry location away from sunlight and extreme heat or cold. The lancet is the sharp piece that is used to make a very small hole in the finger or other area of choice used to obtain blood. Other areas of the body besides the fingertips are acceptable for obtaining blood for a sample. Refer to your specific user manual and follow all instructions for alternate site testing. The lancet device is used to hold and apply the lancet to the finger. Most lancet devices can be set to apply the lancet into the finger at varying depths. You may want to begin with a shorter depth and gradually increase until you are able to obtain a proper sample. To properly sanitize the area and avoid infection, begin the process by washing your hands with soap and warm water. Make sure your hands are completely dry before proceeding, as excess moisture can lead to an inaccurate test result. When your fingers are dry, insert a new and unused blood glucose test strip into the monitor. A used test strip will not work in the monitor. Next, load the lancet device by removing its cap. Place the lancet onto the lancet device. Expose the needle on the lancet. Place the cap back on the lancet device. Then, choose the depth you will use to poke the finger. Now, set the lancet device against the cleaned area of the finger where you will obtain the blood. Trigger the lancet device so the lancet pokes the finger. You must have a large enough sample to completely fill the test strip. Some tricks to try before poking your finger to ensure a sufficient sample include running your fingers under warm water for a minute, milking your finger, or shaking your hand below the waist for a minute. Once you have obtained enough blood, you can now apply it to the test strip. When the result is displayed on the monitor, apply pressure with the tissue to your finger to stop the bleeding. Record the test result as directed by your provider. Carefully take the used lancet out of the lancet device. Discard in an approved container. Remove the blood glucose test strip from your monitor and dispose of in the garbage. This concludes the blood glucose monitoring procedure. For more information, please refer to our resource page.